Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started. Welcome to our podcast, the Chiropractic and Legal Injury Podcast. We are recording here at our holiday seminar right now. And we are so excited. We have our conference coming up, which you'll be at, the Chiropractic and Legal Injury Conference.
Super excited about that.
Oh my gosh, I can't wait. You're going to have to tell us all about it. So first, let's kick things off with an intro. Who are you? What's your role? Where are you located? And why is your work important to you?
Wow. Okay, let's get right off, going off the start.
Right into it.
And thank you for letting me wear my shirt. I wanted something loud enough you could actually hear on a podcast.
My pleasure.
So who am I? Dr. Aaron Wiegand. I practice in Phoenix, Arizona. But one of the things I do that's really my passion is teaching chiropractors how to perform dry needling safely and effectively. And that's what we're going to be speaking about at the January conference. And I practice mostly in PI, and I find those two things go really well together.
Yeah, that's really interesting. Tell me a little bit more about that. How do they fit so well together?
Well, when it comes to personal injury, it's a lot of acute injuries. But you also have people who have chronic pain syndromes, and sometimes it's not the easiest to move these people. And so you need to find ways to get them pain relief without using a lot of manual manipulation of their joints and muscles. Dry needling is an excellent way to be able to do that, actually less painfully for these patients, and it's really effective.
That's awesome. How do you handle people who are afraid of needles? What kind of strategies do you kind of put them at ease for it?
Right. So you always have patients say, I'm afraid of needles, or I don't like needles. And I think anytime you had a patient that walks in and says, I love needles, they've got other issues. Okay, so no one likes needles. But if you can, it's first of all, they're very skinny because they're what's called they're not hollow.
Okay.
They're not like a syringe or something you have to inject in you. So it's super thin, right? And that's what kind of makes needles painful or not, is how kind of thick they are, their gauge.
Yeah.
So also by, you could do deep tissue and you could do an adjustment. Sometimes those things are painful when you're super inflamed. It's a lot less painful to have a quick, poke of a needle, and then the relief is pretty instantaneous.
Okay. Do you have any other people that have come in and I'm really afraid of needles. I really can't do this?
Yes. So I have a test. I have little acupuncture needles because I also do acupuncture in my office. And so if they're able to tap the needle in themselves, just one needle maybe on their hand at a point we call LI4, large intestine 4. If they're able to do that, they're going to get over it. If they're not, that's okay. Sometimes we have to do other things to gain their trust and always, kind of ease them into the process. But once they do, they're typically pretty happy they did.
You make them do it themselves?
I do. Yeah, I figure if they can do it themselves, then they can get over it. If they can't, then it's not the time, and we're just going to respect that space.
Oh my goodness, I don't know if I could do that.
I got my niece to do it she was about 6 years old.
Really?
Yes, and then I turned my back, and she grabbed the needles herself and made antennas out of them, and I realized you have to put them up way higher out of kids' reach, and that was a learning lesson for all of us.
Excellent learning lesson. I have some other couple questions talking about the conference. We've been to several conferences and seminars together now, and I know you teach courses on the dry needling. Mm-hmm. So tell me a little bit more about dry needling for personal injury again, and then just, do you do it also on the side, and what does teaching it look like?
Sure. I mean, it's so fulfilling because I get to travel, I get to meet chiropractors all over the place.
Yeah.
One of the major places we teach is in Texas. We do Austin and Dallas and Houston, so I get to see all kinds of different kinds of offices and how chiropractors, use their creativity to implement dry needling into their chiropractic practice.
Okay.
And really what I tell people to think about it is almost like pain management without injectables. You're able to get down to tissues you've never touched before, like the facet, multifidus, and muscles and tendons that maybe, we've always had to treat through the skin, and you can now do it internally. So I always think of it as just almost like a light pain management, and it's really the first time a lot of us are able to touch the actual tissues that we're trying to treat. If you think about it, most of the pain that we have in whiplash is usually at C5-6. There's a facet sprain, strain, or a tear of the white tissue, and that can be underneath about 50 millimeters of meat, of muscle, right? So that's like two steaks stacked on top of each other, and that's the thing that's causing the pain. It's really hard to get heat and stim and all these other things to go down that deep.
Yeah.
The nice thing about dry needling is it allows you to get intimate with the tissues that are actually effective.
Interesting. Do you find it relatively easy for chiropractors to incorporate this into their practices?
Well, the nice thing is the needle costs like a nickel, right? So yes, it doesn't take a lot of space. It doesn't take a lot of time, and needles aren't very expensive, and so it's an easy thing to implement in what you're already doing, especially if you're already doing things like adjusting, which obviously almost every chiropractor is, and exercise and all your other modalities. It fits nicely within all of what we call a multimodal care plan, which is really what we want to do and what the evidence suggests for these kind of cases.
Okay, interesting. What would you say is the most overlooked aspect of post-accident care?
Most overlooked aspect, I think, I think we miss TBI a lot. I think we need to screen for that, and we need to make sure that people, one, get the proper diagnosis and the proper care that they need for that. I think it's missed way too much. And I think only second to that would be PTSD. You know, there is no pain without some emotional attachment to it. And I'll give you an example. When you have pain, you stimulate what are called like these noxious nerve receptors. Now, when you eat salsa, you get the same nerve receptor stimulated. When you get deep tissue massage, it's the same receptor stimulated, but we wouldn't necessarily call it pain because there's no emotional attachment. It's not associated with fear. If I eat salsa, I'm not worried my body's being damaged. Except for I ate this one chip one time called the one chip challenge. That I thought I actually did damage on that one. But but most of the time, spicy things don't. You know, we're not afraid of it.
Yeah.
So what we have really is pain is a combination of a noxious stimuli plus fear. And if we don't deal with the psychology of the patient and where they're at as far as their fear about driving, their fear about what these injuries mean for their future, and deal with things like PTSD and make sure we're screening for that and getting the proper care that they need, I think that's some of the most overlooked things in personal injury.
That's interesting. Yeah, Larry was talking about that a little bit earlier as well, about how it is an overlooked thing. And also for just, if you get in a car accident, I know I wouldn't have thought about that as an aspect of healing as well. I would just, get in my car and be like, no, I'm fine. I'm fine.
I'm fine.
Yeah.
I'm fine.
Everything's fine.
Yeah. Well, that's just the thing, right? We always talk about the mind-body connection. Everybody's into it.
Yeah.
But we miss it all the time.
We do.
And there's some great tools, especially with acupuncture and teaching meditation, and also getting them the counseling that they need. Those things can do wonders for helping progress their recovery.
You mentioned that you teach meditation. I didn't know that about you.
I do. I teach my patients meditation, especially when they first come in. Yeah, gentle stuff like acupuncture, meditation, a dark room, teach them breathing exercises. Because if I can get the anxiety of the patient to go down, their pain will go down with it. And then I can be a better musculoskeletal practitioner.
Interesting. That's amazing. Learn something new every day.
Well, that's what we're here for, right? Learn
Absolutely.
new stuff.
So that is a fun fact, which is one of my questions. But do you have another fun fact about you that might surprise people?
Let's see. I actually still am able to snowboard at 45. I like to still snowboard. It's like one of my passions, and every year I go snowboarding. And it's one of the things I still look forward to every single year. And this year I think I'm actually going to get a season pass. I'm very excited.
Yeah?
But yeah, I still love snowboarding. I want to be able to do it till I'm 70.
That's amazing. Do you have a favorite spot to go to, or a couple of spots?
Well, I grew up a lot in Flagstaff.
Okay.
So even though Snowbowl is not supposedly the best mountain in the world, it's my home mountain, and I love it dearly.
Okay. Do you go snowboarding anytime you're traveling for teaching as well? Do you hit up the slopes?
Unfortunately, I don't even know if they have snowboarding in Texas, because that's mostly where I travel. But no, it's usually between here and Colorado are my favorite places to go snowboarding, or Tahoe.
Yeah.
No, it's a lot of fun.
We're in Colorado. I'm from Colorado. I was raised in Colorado, so I know a lot of the good spots. Although I'm more of a snowball than a snow bunny. I end up rolling down the hill rather than
I want to see that on a sweater. More of a snowball than a snow bunny.
Yeah. I'm gonna get a sweater. It's gonna be
no, I love Telluride. That's like one of my favorite towns, and Purgatory.
Okay.
Yeah, those are some great, and I love the hot springs out there.
Yes.
It's being cold and extremely hot.
Yes.
It's just a fun thing to do in nature, and I don't know why, but yeah, I love it.
Yeah, that's awesome. All right, what is one piece of advice you wish every accident patient knew?
Every accident patient knew?
Yeah.
I think that the number one thing is you don't assume your injuries are based on how you feel right away. The thing about being in a car accident is a lot of times we have a lot of adrenaline going through our body. I was T-boned by a utility van that ran a stop sign one time, and I got concussed. And I remember I didn't feel anything until a few hours later, and then days later I started slurring my speech. So
Wow.
when assessing how your injuries are right at the moment is probably the worst thing you can do, and you should always go see someone or a professional, a physician, to get evaluated quickly before you make any assumptions about what your injuries are, especially before talking to anyone at the insurance company.
Yeah.
So I think that's the number one thing. Make sure you get checked out. If you're fine, but it's better to be safe than sorry.
Absolutely. And we were talking a little bit about the adrenaline that you feel, and often that hides the pain and the injuries because you've got so much adrenaline in your system and the accident and then the people and then your insurance companies, and you don't even know the extent of your pain until later.
And you shouldn't be making any decisions about your healthcare or anything else while in that state.
Yeah.
Right? You want to be, kind of get a good appraisal of everything and then move forward.
That's awesome.
That's what I love about your firm is you help your clients do that, right? That's
Yeah.
what you do, is help them make those decisions in what's a really stressful and emotional time.
Yeah. That's amazing. All right, so I think I can do one more question. So I have this stack of rapid fire questions.
Okay.
So if you want to pick one.
I get to pick one?
Yeah, why not?
Okay.
It's like cards.
It is.
We're going to play poker.
All right.
They're all going to go everywhere.
Right.
What's your favorite way to unwind after a busy day?
Oh my God, guitar.
Really?
I have an acoustic guitar by my bed, by my couch,
Uh-huh.
and I watch. Yeah, I'll put on something. I'm really hooked on Tulsa King right now,
Okay.
and it's a perfect show to put in the background because you're not going to miss a lot of plot points because it's just Sylvester Stallone going all day, and then you really don't miss anything because you can't understand what he says anyway.
Fair.
Sorry, Larry. And so, but and I just tinker on the guitar. It's the best way to relax.
Oh, that's amazing. You and Larry should have a jam session because he does it too.
We should totally have a band. Yeah.
What would we call the band?
I forgot we had it was something. Oh man, I forgot we had a band name. We come up with band names all the time.
Do you really?
Yes.
Okay.
Yes,
You'll
it
have
was-
to remember and let us know.
Yes, it was. I forgot what the Italian one was. We had an Italian band name, and it was epic. And I don't remember what it is now.
Oh my gosh, we're gonna stop this podcast. 5 minutes later, you're gonna remember.
Probably.
Absolutely. We'll insert a clip later on with what the name was. Well, thank you so much for coming on. It's
Thanks for having me,
so
Ashley.
interesting to learn about this. And as much as we put on these seminars and everything, I end up going around and talking to people and making sure the sponsors are. So I don't get to always listen to all of the talks that happen. But I definitely want to sit in on one and learn a little bit more.
Well, you should. In January, should be fun.
It's going to be great. Well, thank you so much.
Thank you. Have a good one.
You too. From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this podcast with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.